Hi everyone, welcome back to another live stream. It is 30 minutes with Dr. Sylvia, and here I am. I'm a general practitioner and a health educator with AskAwayHealth. Thank you so much for spending a little bit of your evening or afternoon or morning or whatever with me. And today we're tackling two questions that I have received from a couple of viewers, and it's around the Depo Shot this evening. So we're going to dive into that in a couple of seconds, but I hope you guys are doing well. Are you not glad it is the weekend? I am. It has been just one of those weeks, and you know, we are close to the end of January. That's it, 1 month down, 2023. Anyway, so how have you been? If you're watching this on the replay, I hope you find this video useful. I always think that going through questions that people send in, rather than just sort of talking to you about different aspects of these birth control methods, going through questions actually helps people identify issues. You might be able to relate to the questions that are being asked. You might even find the answer to your own issue in the answer to somebody else's question. So I like going through these questions. We're talking about the Depo Shot primarily today, and today's session is not going to be very long. I don't think I'm going to be here for longer than half an hour, really. But just a bit of background. For those who use the Depo or who've not heard about the Depo Shot, let me just explain that it is one of the more modern forms of birth control. It's an injection that you can give yourself, or it can be given by a healthcare practitioner, and it provides you with birth control or contraception for a period of time, on average between 12 weeks. In some cases, it could be as short as 8 weeks, depending on the brand. So there are different ones. Make sure that you know which one that you're going for. Like all birth control methods, it does have side effects. Like all birth control methods, it doesn't agree with everyone. So it's not a one size fits everybody. And I have lots and lots of people on my channel telling me both the good and the bad about the Depo Shot. So please, if you're thinking about using it as a method, do your research, get as much information as possible, talk to your healthcare provider, come here, ask me, that's why we're here. And we can give you as much help about which method might best suit you. Lots and lots of videos on the channel as well, explaining how the Depo Shot works, the key side effect issues that women sometimes complain about, apart from the effect on mood, for example, the effect on periods, for example, the effect on fertility, for example. We've got loads of information on the channel. So thank you so much for joining me. If you're here live, say hello. Let me know where you're watching from. Let me just have a look. I think I see a few people here. Let me know where you're watching from. How's your week been? Any plans for the weekend? Have I got any? No, I haven't really got anything planned for this weekend, apart from just, resting and working on more videos for you guys. I am working tonight though, but once that's done, then I've got a few, about a day and a half, sort of, I'm able to just rest and plan for the rest next week, recharge and think of new things for the next month, which is my birthday month. So I'm looking forward to that as well. Anyway, enough of the chit chat from me. Let's get into the questions. So while I bring them forward, please don't forget to like this video and subscribe to the channel. Okay, share it with somebody who you think might find it useful. And the first question we're going to be looking at is somebody who got pregnant after the delayed Depo Shot. Let me bring up the question because I want you to see what they sent in to me. Let's read it together and we can both tackle, what the situation is. So here it is. Oh, let me take off that bit now so you can see it properly. So let's get rid of this one. And let's go back here. So this is the question I received on the channel. This is regarding the Depo Shot, okay? Of course, I have blanked out the name and details like that because I just want to make sure that it's confidential. You're not poking fun at anybody. We just want to learn from this, okay? So if you send in questions to me and I want to share them, I will always make sure that I mask the identity of whoever sent the question in. So this is regarding the Depo Shot, and somebody wants an explanation to understand what's happened. So here we go. My wife had just 2 shots, that is 2 Depo shots, and she was feeling nauseous. I think that's what that's meant to say. She had breast tenderness, and we went for the test, and it is confirmed that she is pregnant. The second shot was late, 6 weeks. So mark that, guys, mark that. Second shot was late, 6 weeks. She started feeling these symptoms last week. How can it be possible that she is pregnant? We did a home and blood test. I'm not sure what that's referring to. Was this pregnancy test? Yes, it looks like it's the pregnancy test. So they did a home pregnancy test and they did a blood pregnancy test. He says, I thought the Depo was supposed to wear out. So just a quick recap of this question. She's had 2 Depo shots and then started feeling nauseous, breast tenderness, i.e. early pregnancy symptoms, and they went for the test and she's pregnant. The kicker here is that he tells us the second shot was late for 6 weeks. How is it possible that she's pregnant? We did a home test, blah, blah, blah. I thought the Depo was supposed to wear out. So let me come back to you. So, how is it possible you thought the Depo was supposed to wear out? So I'm not sure. I think what they meant to say there was they thought the Depo shot was not supposed to wear out. Now, because, let me say to start with, that because people think when you don't have the Depo, or when you don't go for the injection, there's still a lot of it in your system, so it will provide birth control or contraception. This is one of those things about the Depo. It's one of those things that you have to be regimented about keeping the date of your scheduled injection. When you have the injection and your caregiver or whoever is giving you the shot says, oh, your next jab is XYZ weeks away, 3 months or 8 weeks or whatever weeks away, please keep to that date. Really, you have perhaps a week grace period around that you can take it. That is, if you miss that date, because life happens, you might have a 1 week grace period where birth control protection is not broken. What am I saying? That if you have the shot today and they say to you, come back in February, April, whenever, 3 months away, please stick to that date. If you think that waiting 6 weeks after that date, well, that the effect of the Depo is still in your system, so it's going to provide you birth control, that's wrong. I think this is what my chap here is thinking. So the birth control effect, as soon as that 3 month has expired, begins to wear away, you're not safe. You could potentially get pregnant, potentially. And I know this sounds difficult because on the other hand, we tell women that, oh, the Depo shot can cause delayed fertility and all the other things that we say. Yes, that is true. And when I come to the next question, you will think this is really confusing, and I totally appreciate that. But the honest truth is that it is possible that you could still have the hormones swimming around in your system if you miss the next dose. But the amount is not enough to prevent ovulation. It might be enough to cause other problems and other side effects and things. It may not be enough to cause ovulation. So that is why you must keep to your planned date. That is when you are supposed to have the injection. You need to stick to it and not imagine that coming to have it 6 weeks late means that you're protected. In fact, if your caregiver understood that you were 6 weeks late, the first thing that they should do is arrange for you to have a pregnancy test first. And if it's negative, will they go ahead to give the second shot? Because you're so many weeks late, really. You're wide open you're vulnerable to being pregnant because you're not covered. During that 6 week period, you're just not covered. So the first thing is to make sure that you're not pregnant. And then the other thing to remind us is that even though this method is highly effective, yes, we say it is one of the most effective methods, but it's not 100%. It isn't. There's no method that's 100%. There will still be some percentage of people who, even though they're taking it as scheduled, could still fall pregnant. And I have a lot of them. I know a lot of them, both on the channel and outside the channel, who are taking it as planned and got caught out. And they'll tell you, well, I got pregnant on the Depo, because it's not 100%. So that's one. And the second thing is, when you have your date, when you're supposed to have the injection, please stick with it, okay? So for anyone just joining, hi, welcome to the stream. We're talking about the Depo shot and some complications that my viewers like you sent in. And the first one was about getting pregnant after a delay on the shot. And I'm just trying to explain that even though you still have some of the hormone going around in your system, it's not enough. Once you've passed your due date, it's not enough to provide you with contraception, with birth control. You may still have some side effects, you might still have problems, but it is possible that just that drop in the amount of the Depo, right, is not enough to prevent you from ovulating, and so you could get pregnant. So that's what I would explain to this couple who are wondering why, that even though it was just 6 weeks, it was just 6 weeks. Yeah, but that 6 weeks is too long. It's much, much too long. So that's why, either because he was just one of those people who were in the small percentage of people, the less than 5% of people who it will not work, because that's the method. It is highly effective compared to things like the condom or the withdrawal method, but it's not 100% like abstinence. It will still fail, even though it's highly effective. So that's the one. And the second being the fact that, well, don't delay it. Okay, don't delay it. If you have to, if something happens and you can't get your shot or whatever, then it's about using protective measures like the condom, for example, or the withdrawal method, for example, or just doing something that making sure that you are aware that you're not fully covered if you're delayed in getting your next shot. So I hope that we've covered that. Let's just look at the question quickly again before we move to the next one. So she had just 2 shots. She was feeling nauseous, breast tenderness, and then we found out she's pregnant. The second shot was late by 6 weeks. How is it possible that she's pregnant? So this is how it is possible. Either she's one of those people in whom it just didn't happen because the drug is not 100% effective. And the second thing being that you waited too long, you delayed too long from having the next shot. Okay, so that's that one, that's that question. Guys, thank you so much for joining. Hi, if you're joining in the live stream, thank you so much. I hope you're well. And if you're curious about the Depo Shot and other birth control methods, anything to do with general health, women's health, sexual health, this is the place to be. We've got lots and lots of videos. Please like this one, subscribe to the channel, share it with a friend. Ask a question if you want to. If you've got something around this topic, please feel free to ask. Okay, so we've dealt with that one. And the next one we're going to tackle, number 2, is not pregnant 9 months after the Depo. So this one is an interesting one because it's almost opposite of the one that we've just been looking at. Let me pull it up. So, okay. So let me take the tickers away so that we can all see this very clearly. So take this one away, take that one away. Fine. So this is the next one, okay? So it says, hi, Dr. Sylvia. I last received my Depo shot in April last year and did not receive it again when it was due in July. So she had last had the Depo was April. Boom. That was the last time she had the drug in her system, or that she had the drug injected to her system. Then in July, she started having her period. Now, remember that with Depo, you can have a delay in fertility, delay in return to your period, but she didn't have much of a delay. She last had it in April, and pretty much by the time it was due, the next shot was due, her period had returned. Can you see how this drug behaves? It's different in everyone. She started having periods. There's some women who won't even see their period for 12 months or 18 months on the Depo. So this is how, like I said at the beginning, we've all got different experiences. Okay, we're talking about the Depo shot. If you're just joining, hello, thank you so much for joining. I appreciate your coming in. Thank you. And I hope you find this useful, especially if you're watching this on the replay. If you see the title and you click on the video to watch, I really hope it helps to answer your question. And if you have anything else you want to clarify, by all means, drop it in the comment section or use my email information service. The link is always in the description. If you want to ask a question and you want some clarification or guidance around something to do with this or other aspect of sexual health or general health. So back to the question, I started having my period in July. I've been tracking my ovulation and they have been positive, but I'm still failing to get pregnant. Now listen. Could this be due to an issue with my uterine lining or residual side effects? I am confused why I am getting my periods and ovulating but not becoming pregnant. Please help me. Weeping emoji. I am 26 years old with no underlying medical issues, had been on Depo for about 8 to 10 years. So a few things to pick. And thank you so much for this question, because a few things to pick, and I think we can all gain some education from it. Okay, so she had the Depo back in April, which is what, so about 3 months short of a year, so about 9 months now. And she started having her periods 3 months, April, May, June, about 3 months after she last had the injection. So since July, for at least 5 months, she's been having regular periods. Regular periods tells us what? She's ovulating. That's pretty much what it tells us, that she is ovulating, because it is the process of ovulation. I'm not going to go into too much detail, guys. We'll talk about this in other videos if you want to understand, but it's the process of ovulation that leads to the period. If you know, you know. Basically, so when an egg is released, travels down into the womb, if fertilization does not happen, that egg disintegrates or dies, and it is that egg's death and the tissue of the womb that had been preparing for a baby, which didn't happen that particular cycle, that is what you lose as a period. So that's what I mean by saying that ovulation is what leads to the period. So the fact that she is having a period tells us that she's ovulating. But even the icing on the cake, she's been tracking ovulation, and it's been telling her that she is ovulating. So she's failing to get pregnant. What is going on? So she says, could this be an issue to do with her lining and with the uterine lining? Number one, there is no evidence that the Depo shot, that's the progesterone injection, has any effect on the womb lining. Okay, there is no evidence that it has any permanent effect on the womb lining. Now, I say that because it contains progesterone, and yes, it could potentially affect the lining. This is what is inside the, what do you call it now? The emergency pills. The emergency pills, whether it's Plan B, Take Action, eye pill, what do you call it now? The Postinor, the Post pill, you know, all those group of medicines contain progesterone. And to a little extent, we know that the main thing they do is to delay ovulation. But to a little extent, let me take this off because you're just seeing the question, you're not seeing me. Let me just get rid of it here. Just for a couple of seconds, we'll come back to it. The main thing that the main method that the emergency pill, which contains progesterone, works, the main way it works, we know, is to delay ovulation. But we also know that it could make your cervical mucus a bit thicker, so that makes the sperm struggle to swim in it, and so it prevents fertilization to some extent. The other thing that it may do is just make the womb lining a little bit thicker, a little bit less, make it a bit difficult for the egg, if it's been fertilized, to plant. That is for the pregnancy to develop normally. So by these methods, it's thought that these progesterone pills have an effect. Now, our question is, this lady is saying, could it be that the progesterone in the shot has affected my womb lining? It's not whatever effect is reversed once you stop taking the injection. Whatever effect, if at all. So it's not a permanent effect, it's minimal, to be fair. I'm not saying that there isn't, because obviously there are some women who have a lot of bleeding because they're on the progesterone shot. So to an extent, it can affect it, but it's a minimal effect. And it varies from one woman to another. And given the information that we have from this lady who is having regular periods, I think that's unlikely. Could it be residual side effects? Now, she could have residual side effects, I completely agree, but I do not think her fertility is impaired. She's ovulating, she's having periods. She's ovulating because she's having a tracker that's telling her she's ovulating. She's having irregular periods from what she's saying. So I don't have much of a doubt that she's ovulating. So whatever side effect is not affecting her fertility. It might be other things, because the Depo shot, like we've said in separate videos, it can take some time for the full effect of the hormone. It's not a big dose that you get in the injection. And it might take some time for the full effect of the hormone to come out of your system. But like I said in the previous question, that once you've passed the due date and the quantity of the hormone starts to come down, okay, you do not have the contraception or birth control protection anymore. So please don't think that we said, oh, well, after 3 months on the Depo shot, and if you stop taking it, it begins to wear out of your system. And so it's fine, or there's still a little bit in your system, it doesn't completely go away, because that's what the other couple were thinking, that, well, we're 6 weeks late, but it's fine, there's still a bit of the shot in my system. There is a bit of the shot in your system, yes, but not enough to protect you from an unplanned pregnancy. That's number one. Back to this lady, the side effects could be different things, perhaps headaches, it might be something to do with spots, it might be something to do with weight or mood, different possible side effects. But simply because there are residual small amounts of the Depo, it's working its way out of your system. Around 12 months or even less, many scientists believe that the level of the shot has actually come down in your system. The other thing I know would be on her mind, because she mentioned it, let's bring up the question again, because I didn't want to forget it, but I just wanted you to know that there is a human being behind the screen. Let me just pull up the question. If I can find it. Yeah, here it is. Okay, so the other thing that she said, look at it here. She says at the very bottom, she says, I've got no underlying medical issues, and she says, I've been on Depo for about 8 to 10 years. Is that relevant, guys? Is that relevant? That's a worry. I know that ladies will have that, oh, because they've been taking it for years, it's damaged something, it's done something. There is no evidence for that. I understand why it's a worry. I understand why you would think that this may be why you're not experiencing pregnancy. You might think, oh, some damage has happened. There's no evidence at all. And there are many women who've had the Depo shot for this long or longer and still been able to fall pregnant. And actually, the research suggests that the return of fertility does not depend on the length of time you've been on the shot. That means that if it's somebody who's only had the Depo twice, so they've only been on it for 6 months, they could also have problems with fertility. That is the nature of this drug. We don't have answers for every single explanations for every single way that it works. We know from research that it might affect some women in this way, and it might affect other women in other way. Okay? So, in a nutshell, I'm trying to say to this lady with this question, I don't think it's your womb lining. You may have residual side effects, but they're not affecting your fertility because you are ovulating. I don't think it's anything to do with the fact that you were on Depo for 8 years. And you've told us you haven't got any underlying medical problems. So why, Dr. Sylvia, am I not getting pregnant? That's the question. So let's look at this in the same way that we would look at any other person who has been off birth control for the last 5 months. July, she said, didn't she? That was, about 5-6 months now. And is not getting pregnant. Let's consider. So what are the other things that we'll be thinking about? The fact that she's 26 tells us that she's still got very good ovarian function. That's what it tells us on the face of it. I don't know this person. I don't know her medical background or anything else. But she's young. So that tells us that she's not menopausal. She's not in her late 30s or even mid 40s or whatever, where we might say, well, perhaps ovarian function is declining. She's in the nice age where you can say ovarian function is at still near its optimal. So we shouldn't have any problem with producing healthy, nice, mature eggs. But what are the other things that determine fertility? When we need to look at, well, how frequently are they having sex? Because that's the other thing. According to definition from the NHS about infertility, about 84% of couples will conceive naturally within a year if they have regular unprotected sex, and that is every 2 or 3 days. So one of the things that we look out for is how often are you having intercourse, and are you making sure that it's at the time when you're at your most fertile period, and how long have you been trying for? Usually, just in terms of a benchmark, it's not something that you hold on to religiously, but just in terms of a benchmark for the average young couple who are having regular unprotected intercourse and in reasonably good health, we look at a benchmark of about 12 months, within which 84% of them should fall pregnant. Some may not fall pregnant, some may take a little bit longer, and not that there's a problem, they may just take a little bit longer. So what would I be saying to this lady? After finding out from her, are you making sure that you're actually putting yourself in a place to get pregnant? Are you making sure that you're taking the prenatal vitamins, keeping yourself healthy with avoiding stress, a healthy diet, regular exercise, and everything else that you need to be pregnant? Are you in that place? And if you are, it's probably best relax. Don't panic. Don't fret that the Depo has done some big thing that's preventing you from getting pregnant. That's one of the things I'd say to her. I don't know about her partner. You see, there's so much that we don't know here. We don't know about the partner. We don't know how old they are. We don't know if there are issues on their side. So again, we have to think, because it all looks as if it's all from her side. That might not be the case. Depending on the partner and depending on whether he's got any issues. And by the way, I do have 2 videos now speaking to male fertility. I think there are 2, or there might be 1 in the pipeline, but at least there's definitely 1. So go and have a look. What are the issues that affect male fertility? Because it's not just about her, really. By the time we look at her and everything seems fine on her side, what about him? Is there anything that has he got motile sperm? Has he got enough sperm? That needs to be looked at as well. So I wouldn't panic at this case, is my response to this question. I wouldn't panic. I will definitely look at your partner and look at what you're doing to ready yourself. Should you go to the doctor, you can go and have a chat with your doctor. That's not a problem. Go and sit down and express all this to them. They can ask you more questions than we can do here and talk about your partner as well and give you advice. They may just give you advice, and when they check that there's nothing to concern them at this time, they might say, do this, do that, and let's see you again in a couple of months. And they might want to take it to a year if they've not seen, if there's nothing. Because remember, if it's an older partner or somebody who maybe if the man has had children before, and she's particularly anxious, then they might think, right, let's do something a bit more intensive and let's start doing some blood tests. They may or they may not. But the main thing I would like to reference here is to avoid panicking and worrying that the Depo shot has caused any permanent damage or preventing her from falling pregnant because she's used it for 8 years, or because it's damaged her lining, or because of side effects. That's not the case. She's ovulating. I think, barring anything else, I think she's in a good place to get pregnant within the time frame or slightly over. But the important thing is not to stress about it. If there are issues from her partner's side or anything else that she's not mentioned to us here, she needs to sit down with her doctor, get a proper history, proper information, an examination, arrange blood tests to go along with that. So guys, those are the 2 questions that came in the last week, and I wanted to share with you because, again, like I said, I think these questions and answers can benefit other people, and sometimes you haven't got the time to sit down and do a video regarding the specific issues. But I hope you found that helpful. I hope you found that useful. If you've got any questions around similar topic or anything else, on the channel we talk about many different things. We cover child health, we cover pregnancy as well. As a general practitioner, I deal with these things on a daily basis, so it's natural for me to talk about them. And as I go from one end of the spectrum to another, we cover different things to do with women's health, family health, men's health as well. So guys, please let me know what you think about the video. Let me know if you've got any questions. Don't forget to use the email health information service. It's a bespoke service. On YouTube, I certainly cannot start giving you specific information because, one, there's only so much space that you can use to ask questions, to clarify, to explain. That's not possible on YouTube. But with the email information service, you can take time to gather more information. In some cases, I might send you out a questionnaire to fill out and give me some detail. All information is confidentially held, but then I can address the issue that you're concerned about, and we can be specific and just go into a little bit of detail, explaining things for you and directing you or showing you where you can get more information or what to say to your medical practitioner to help you get the best care that you need. So thank you so much for joining me. We're going to round up here, and please look out on the channel for the next few videos coming up. We published one yesterday on vaginal infections after sex. That's another hot topic. Please go and check it out. Show the video some love. Thank you so much for being with me this evening. Don't forget to like this video. Don't forget to subscribe to the channel. And I thank you so much for the engagement and support. We recently hit 13,000 subscribers, and the views are going up as well. And I do want the engagement to grow. I want our community to grow. It's a support community where we can have questions or queries and concerns answered in a safe space. So guys, thank you so much. I hope you all have a great weekend, and I will see you again soon. Okay, bye-bye.